Hi, I'm Dr. Whispers. I'll be performing your cranial nerve exam today. I know you haven't had one in a long while with me, so it's probably best to go ahead and have another one. And you do kind of recall what we do, correct? Right. We're checking on basically all 5 of the senses: hearing, smell, taste, touch, sight, and just doing different areas. I'm going to start with the smell. The reason I do that is because when I get to taste, I don't want them conflicting with each other if you do one right after the other. So I'm going to start with smell, and I'm going to move on to sight, then I'm going to go on to touch, taste, and then hearing. I believe in that order. I may change it up a little bit, but I am going to start with smell. I will be wearing gloves while I do this. And since you have had this before, if you recall, it is very relaxing. And you didn't have any issues before, but just in case, we're going to do a check to make sure that you don't have any type of issues now. I've got a few other things I'm going to check that I didn't do the last time, and we'll see if anything's different about it or anything. I don't think it will be, but we'll check just to be sure. Okay? Alright, so give me just 1 second. Okay. So I'm going to start with my gloves on first. I'm just going to go ahead and have them on the whole time. And I'm going to start with the olfactory, which is sense of smell. We've got 3 different small cups here with a clear liquid in them, so you shouldn't be able to tell by looking at the liquid what's in them. It shouldn't give you any hints. And I want you to be able to hold each one up to your nose, and I want you to smell of it and tell me what you think the smell is. Okay? I'm not going to give you any hints as to what type of smell it is. I just want you to be able to look at it, and I want you to be able to smell of it and tell me from smelling if you can tell me what it is. Okay? Right. Here's the first one. Good breath in. If you need to take a second, that's fine. Good. Okay, I'll give you just a second. Breathe in a couple of times, some fresh air. Okay, here's the next one. Use it again. Okay. Peppermint. That's good. Okay. Alright, and the last one. Okay, I'm going to try again. Pineapple, that's very good. So all that seemed fun. Part is going to be the ocular. What I'm going to have you to do first is I want you to look at this picture behind me. Don't look at me. I'm going to get very close to your face, but I want you to focus on the rose in her hand, okay? Okay, now in just a second, I'm going to hold a small object in my hand in front of your eyes, and I want you to focus on that object. I want you to move your eyes, focus from that rose to the object I'm holding in my hand, okay? Right. Now focus on this object. Now let's put it in the other hand so I'm not in your way. Alright, now focus again on the rose. And back to this object. Good. Your pupils dilate and constrict depending on how close or far away an object is that you're focusing on. And yours seem to have done just fine. Okay. The next part of the optical, I'm going to see how your eyes react to light, movement of light coming in, going out, and then getting closer and further away. So, if you will, this first part I'm going to see if both of your eyes follow light in unison together. So, both of your eyes, I want your eyes to follow the pin light. Don't move your head, just follow it with your eyes. Good. Good. Very good. Good. Very good. Let you blink for just a second. I'll tap something in. Okay, I'm going to come in now. Doing your peripheral vision. Sorry. So just stare at the picture behind me with both eyes, okay? Stare at the picture. Don't look at the light this time. Okay. You're great. Can you stare at the picture back in the back, please? Are you still comfortable? I think we'll go ahead and do taste now. You should be, after doing the side one, you should be good on that. What I need you to do for me is I've only got 2 different flavors here for you to test out. They tend to not be flavors of that. I know some people are sensitive to certain tastes, but they shouldn't be anything that make you, most people aren't sensitive to them or anything. They're actually pleasant flavors. But what I need you to do for me is open your mouth. I'm going to test out each one first on the sides of your tongue. I just need you to tell me if you can taste whether it's sweet or salty. That's all I need you to tell me on that part, okay? And then after that, I'm going to get you to test it out on the tip of your tongue, and you're going to tell me what the flavor is, okay? Okay, so open your mouth, ready? Side. Is that sweet or salty? Good. Try the other side. Should be the same, but just in case. Okay. Open the light again. Is that sweet or salty? And the other side. Okay. Now here's the flavored. Tell me what flavor that is. Good. Orange. Good. Very good. Your sense of taste seems to be just fine. I'm going to ask you a couple of questions real quick. Have you had any type of headaches or anything lately? No. I mean, other than just like a stress headache or anything. You don't have migraines or anything like that? Any loss of balance? We're about to check that too as well. Okay. Let's go ahead and do the sense of touch. I'm going to get you to close your eyes for me. I'm going to be touching your face with different objects. Some are soft, some are hard, some are hot, some are cold. And by hot, I don't mean like searing, just warm. And I need you to tell me, I'll ask you which it is, and you can let me know just by touch. And after that, I'm going to be, let's see, checking a couple of other things on your face. Then we'll go to hearing, and then I'm going to go to your sense of balance, okay? Okay, so close your eyes for me. Right. I'm going to be touching you with an object. I need you to tell me if this feels on your forehead. I need you to tell me if this feels soft or if it feels hard. Is it soft or hard? Soft. Okay. To another part of your face, on your chin. Is this soft or hard? Hard. Another part of your face, soft or hard? Hard. Right under your eye, soft or hard? On your nose, soft or hard? Good. On your ear, soft or hard? And on your other ear, soft or hard? Okay. Alright, continue to keep your eyes closed for me. Okay, I have two objects here. One is pretty cold. The other one is fairly warm, and it has a rubber tip on it that's warm. It's not hot, but it's very warm. It's certainly much warmer compared to the metal tip of this other object. So, I need you to tell me, when I touch different parts of your face, do you feel warmth, or do you feel something warm, or do you feel something cold? Warm. Okay, good. Warm. Okay. Warm. Good. Warm. Good. Cold. Cold. Tip of your nose. Between your eyes. Cold. Good. Forehead. Cold. Good. Under your chin. Warm. Very good. You do me a favor. Okay, you can open your eyes now. Sorry, I should have said that. You can open your eyes now. Okay, I want you to open your mouth really wide. Good. Alright. I want you to try and yawn. Normally when somebody tries to yawn, they will actually yawn. It's just a normal reaction. witnessing the upward movement of your soft palate. That's something you also want to check when you're doing a cranial nerve exam. Okay. Swallow for me. Okay. Now swallow and say hello right after you swallow. Good. And stick your tongue out. Up. Good. Let's do it again. Alright, so go ahead and close your eyes for me. I am going to make a sound. It's going to be a metal tapping sound on each ear. I need you to tell me at what point, which ear you hear it in, and then just raise your hand when you hear it, and then tell me which ear it is you hear it in, okay? Alright, so go ahead and close your eyes for me. Okay. Good. 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 Much closer or further away? Closer. Good. Good. Now, I need you to tell me if you hear this from the front or the back with both ears, okay? Back. Good. Good. Front. Good. Left or right? Good. 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 Further away, closer. Good. Chair. Further away, closer. Taking your sense of balance, so if you'll give me just 1 second, we'll get something ready, okay? Okay. So what I need you to do is, I'm going to be trying to press down on your shoulders. As I do that, I want you to shrug it up for me. Okay. Start pressing now. Shrug. Good. Okay, do it again. Good. Right. I'm going to try and hold your arms down on the sides of your biceps. I want you to try to lift your arms up for me, okay? Lift them up. Good. Okay. Now, I want you to have your arms lifted up, and I want you to try to put them down. Hold them up like this. I'm going to put my arms underneath, my hands underneath, excuse me. Push them up, okay? Good. Okay. Look straight ahead at me. I'm going to grab your face like that. I'm going to try to move your head from side to side. I want you to try to hold your head still for me, okay? Just try to hold it still. Good. Again. Do you have any pain when I do that? No. Very good. Okay. Close your eyes for me. Okay. Take your arms and start stretching them out laterally. Good. Hold them there. I'm going to take my hands and push them down slowly. You don't have to resist, but just let me push them down slowly for you, okay? Good. Very good. Very good. So, I think that takes care of the cranial nerve exam. You did excellent on all of it, as you did last time. And we will see you back in probably a couple of years, unless you feel like there's some type of change or something you want checked again. We can always do it again. But as far as for now, everything seems perfectly fine. All areas seem perfectly normal. So you are good to go. So I'll see you later.